Director of Cardiac Sciences, Dr. Suresh Shah, who will be joining us now, the cardiac anesthetist and the head of cardiac critical care, Dr. Nandkishore Kapadia, Senior Cardiac Surgeon, Dr. Ravi, the press who has been patient all this time, and all gathered here. We at Fortis Mallar Hospital have helped revive the life of a 56-year-old gentleman who had suffered a massive heart attack. The reason why we have gathered here today is a witness to the fact that he is back on his feet through a technology which is relatively new in our country, ECMO. To brief us more...
Slides, but basically the reason we were keen for this meeting was, as you know, one of the commonest causes of death, especially in young people or in their 40s and 50s, is massive heart attacks. And reach in time and try and do an angioplasty or something. Several times the recovery.
And I'm sure nobody will know better than you. And news for the somebody mentioned 25% of heart attack patients die even before reaching the hospital. Another 20%, the red slides are all patients who had an unsuccessful angioplasty. And the green are patients who had successful angioplasty. Even when there is a successful angioplasty, still 40% don't survive. These are all worldwide established figures. When there is no question of doubt about it. Nobody is a 55-year-old male who lives nearby, and he is admitted on 17th with severe heart failure and low blood, came fully to normal, only to 50-60. So intra-aortic balloon pump, which is a pump which is put in the aorta. It's already put, all injections going on, patient is on ventilator, still no effect. His blood is dark. This is actually the example of this machine. Is a pump. The other side is the oxygenator. These are the tubings which are going to the body of the patient. So basically there are two tubes. One tube is put on the venous system. That takes blood into the pump. There is one tube going to the arterial system which pumps blood into the body. This is very simple what has to be done, but these tubes take time to put in the body. So it's a compliment to the surgical team that they could do it within 30 minutes. It's a great effort on that. Briefing that why there is a high mortality with patients who are sick with heart attack. There is a basic reason why, especially in the US and other countries, is in this H1N1 or swine flu with lung damage, medicines, drugs, the heart is slowly recovering. Many times it doesn't recover fully. These are the patients in which patient is even years. He is on this artificial pump.
He's able to talk on the cell phone. His heart is not beating at all.
Heart is heartbeat.
Even for us, it was very interesting. After so many years in this.
So he is on an artificial pump.
He's able to talk. He's an 81-year-old man. 1 week ago, he had a cardiac arrest. Now he's talking on the phone. With no cardiac action at this point in time.
The present patient, of course, is very conscious. He's conscious. Next. This is just a mention of the implantable heart. So just to give you a briefing, that this is the device, the new one, latest artificial heart, which can be put inside the body. So these are the. So we just
sold for little under $3,000. $3,000. Yes, around 1.5 lakhs. But unfortunately, this dollar is going up. So, unlike the whole heart-lung machine, that's a roller pump. This is a very small, miniature centrifugal pump. So the heart-lung machine roller pump, after 6 hours, the blood will be damaged because of hemolysis. Plus, the oxygenator is very, very small. In fact, the more recent versions, they have a Diet Pepsi can next to it to show that that's how small it is. Our heart recover or normal.